welcome to this week's edition of Health Corner. I'm Dr. Opaka. Today we're speaking on fibromyalgia. Fibromyalgia is a very difficult condition for people who suffer it. It's poorly understood. Today we have a consultant in rheumatology, Dr. Bharadwaj, who has been invited to speak on fibromyalgia. Doctor, you're welcome.
Thank you very much.
Yeah. Dr. Bharadwaj, you find out that people would like to know what fibromyalgia is all about. It's a very difficult condition which we see often in the community. But people who suffer it probably don't understand it, not even the society or even many of the health professionals. Please, it would be a pleasure if you can give us some information regarding this health condition. Please, you're welcome, and I'm sure the viewers are listening for, what are you going to say regarding fibromyalgia?
It's a very important topic, and it's, as you said, it's very poorly understood. The knowledge is evolving. There is a lot of research going on regarding the condition. It's a long-term condition that can cause widespread pain all over the body, and it's associated with tenderness, that is pain on the minor pressure all over the body. And surprisingly, it's a very common illness. 1 out of every 25 adults may be affected by it. So approximately 4 out of 100 people. It's more common in females than in males. There has been various terms used since 19th century to describe the conditions, including muscular rheumatism, fibrositis. Not exactly similar, but even ME the term has been used for fibromyalgia.
Right.
But now the specialists are thinking that fibromyalgia is the best term. The condition is misdiagnosed for a long period of time. Some people diagnose it as other arthritic disorder like rheumatoid arthritis, ankylosing spondylitis.
Yeah.
Some people diagnose it as connective tissue autoimmune disorder like lupus. And it takes a long time before a specialist clearly tells the patient that this is fibromyalgia.
Right.
And the symptoms can be very similar to other disorders. So we have to be having a high level of suspicion to diagnose this.
Right.
But the new thing is that fibromyalgia can coexist with other disorders. So it's not that it's in isolation. There people may be suffering from rheumatoid arthritis and lupus, but simultaneously they may have fibromyalgia with it.
Right.
The difficulty in diagnosing the patient is that there are no outward signs. Signs mean I can see the features and say, okay, yes, you have fibromyalgia. But there are features on examination which a specialist can look for and can be fairly certain that this is fibromyalgia. Okay. So it's not that difficult to diagnose by a specialist. Okay. The main symptoms are the pain, as is true in majority of rheumatological disorder, and it's a widespread generalized pain. At both sides of the body, both upper half of the body and lower half. People can have pain in one side than the other, but it's a widespread generalized pain which is troublesome. People feel exhausted, extremely tired because of the illness. And thirdly, many of them, rather most of them, have a very poor quality of sleep. They have a multiple sleep disturbance. Either they can't sleep properly, or they wake up, or they can't sleep at all.
So, like what you said, it can have other underlying conditions. I know people suffer from depression and chronic fatigue syndrome.
Yes.
So they can have that and also have...
Absolutely.
Right.
So this is a spectrum of conditions. Some people have mainly the fatigue part of it, while the others may have more the pain part of it.
Right.
And the mood disturbance goes along with it. And of course, if you are in pain all the time, it does make you feel low and frustrated with the illness. The effects of these symptoms vary from person to person, as is true for most of the diseases. And from day to day, sometimes they are much worse, and they don't know what's the reason today I'm feeling worse. And then it can be better than other days. They say fatigue. Most of them say fatigue is a worse part of the condition, and they feel exhausted, they can't do. Many of the people complain that they can't think clearly and properly, and this is sometimes called as fibro fog or brain fog. They feel like confused at times and not very clear in ideas.
That's interesting. I mean, the word fibromyalgia, I mean, how did that this word come about? I mean, with this disease?
Yeah, fibrositis is because it affected the muscle fibers and all, and multiple parts of the body hurts, that becomes the fiber.
Right.
And myalgia is the pain in the muscle.
Pain, yeah.
So because the predominant symptom, as is true in most of the rheumatological diseases, is the pain, the pain in multiple muscles and muscle fibers is fibromyalgia.
Right.
But now we know it's not only the pain which affects, there are multiple other symptoms which can affect a person and makes the life difficult for the person.
Right.
And one of them is fatigue, fibrofog, brain fog, etc.
Right.
And the day-to-day variation is there. The weather may change it. Sometimes the cold weather makes it worse. Sometimes the hot weather makes it worse. So it differs between the individual.
All right. So it can be weather dependent.
It can be weather dependent. And as our mood changes, our health changes at different weather, we feel worse on some days than others.
Right.
Then there are other symptoms. Some people complain of poor quality of circulation. They feel that their hands are puffy, they get tingling, numbness in the hands, they get the similar symptoms in their feet. Headache is very common. Many of these patients have been diagnosed as migraine by other specialists. They get irritability of the mood, they feel miserable. It looks like the disease has taken over completely their whole life. Sometimes there is a micturition or difficulty in passing urine. They have urgency, especially at night. They feel irritable and uncomfortable bowel. And many of them go to the gastroenterologist and other tummy specialist for irritable bowel syndrome.
Right.
Not inflammatory bowel disease, but irritable bowel syndrome. And these are other symptoms. And there are many other symptoms which can coexist with this disease.
Right.
It's often difficult to diagnose. As you have said, and we know, there are no specific tests, there is no specific sign. It takes a clinical intuition by a specialist to diagnose it.
Right.
And sometimes the diagnosis gets delayed for long time.
So people need to seek specialist opinion to get it diagnosed.
Absolutely. The correct diagnosis is important. One is to make sure that you are not missing out any other serious disease.
Yes.
And secondly, to receive the right kind of a treatment.
Right.
If you are misdiagnosed and people diagnose it as rheumatoid arthritis, they may give strong agents like steroids, disease-modifying drugs, and patients feel worse.
Right.
But if you diagnose it correctly, then at least you will avoid the toxic agents which are used in other conditions.
Right. So the specialist here then is a rheumatologist.
A specialist has to be a rheumatologist, and generally a rheumatologist. I should not say has to be.
Exactly. Okay. Yeah.
Many a times it's frustrating for patients because patient is going with an idea that I will go to the doctor, have a scan or a blood test, and it will confirm. But majority of the scans and blood tests are normal. It's a diagnosis by the clinicians on the basis of your features. So don't look for a positive scan or a positive blood test because these tests are mostly done to rule out other serious disorders.
Right.
And that's how we pick up the diagnosis of fibromyalgia. So the criteria are evolving. Our knowledge about the disease is evolving since last 19th century and 20th century. Initially, people felt that we can pick up the fibromyalgia based on the number of specific tender points over the body. Now, in 2000, after 2000, 2010, we are thinking tender points are not enough or not important, but there are other features also important. So the criteria for the diagnosis have been evolving over a period of time, and now there are 2016 criteria to diagnose and classify the patients with fibromyalgia and to help us healthcare professional and specialists to classify it better. And what we look at is three main things. One, widespread pain, which is lasting for more than 3 months. We look at the fatigue or patient waking up in the morning feeling unrefreshed and tired. And third is problems with the thought process. I can't think properly. I different features on the basis of which we diagnose fibromyalgia.
Okay.
We don't know yet what causes fibromyalgia. There is an interaction between the physical findings for the patient, some kind of a neurological changes. People are trying hard with the brain scans, endorphins, neurohormones to look at what changes in the central nervous system which makes the people prone for this illness. And there are psychological factors. So the mood, the emotions, the stress in life can make and affect this illness come up and even get it worse. So it's an interaction between physical, neurological and psychological factors, which plays a role in bringing out this illness.
Right. So does it mean that, I'm sure the viewers will be wondering, does it mean that people with fibromyalgia probably react to pain differently from others?
Absolutely. There is a kind of a pain pathway disorder, and I will use this term again and again, because sometimes the problem is not just in a group of muscle, but it's the sensation which goes from the muscle to our spinal cord and the brain, and the way it is processed, that is somewhere goes wrong. And why it goes wrong, we don't know. But that is the reason why people feel that it affects the brain, it affects the emotion, it affects the way we perceive the pain on a day-to-day basis. And people, when they are emotionally low or stressed with their work or because of some other kind of a stress in the family, it makes their pain actually much worse. And even their tiredness is much worse. And they can't function properly. So there is a strong role of stress, emotions, and the mood.
So stay tuned. We're going to take a short break. And when we come back, Dr. Bharadwaj still has a lot to talk about regarding fibromyalgia.
Meet Anne. Anne is thinking about sending goods to Africa. Her first thought came to MDS Cargo. Send goods to Nigeria, Ghana, and many more countries in Africa. Excellent customer service and after-sales support. Free London and Essex collection. Online tracking.
Fast Cargo caters for all your door-to-door sea and air cargo services from Nigeria to the UK and UK to Nigeria. With prices from 99p per kilo, you can't go wrong. For prompt, efficient and dependable service, call Fast Tracks Cargo today.
Health Corner on Ben TV by Crystal Life is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystal Life.
Welcome back to the second segment of this episode. This week we're talking about fibromyalgia, and we have the pleasure of inviting Dr. Bharadwaj, who is a consultant in rheumatology in the UK, to talk about this difficult health condition. Dr. Bharadwaj, I know many viewers will be wondering, what causes fibromyalgia, and is there anything people can do in this segment? I'm sure the viewers would like to hear a little more about this aspect of the presentation.
Yeah. So the concept of pain is there is some kind of an insult, either a pinprick or a chemical or heat, and that impulse causes a sensation which goes to the brain. Brain processes it and then gives you a command, remove your finger, remove your hand, and the pain goes away. Now, as we are sitting, we are in pain. Our legs are in certain position, our back is in certain position. But the brain has learned a way to ignore this pain on a day-to-day basis. And this brain does by inhibiting the fibers, and which are called as inhibitory fibers, and they release some kind of a substance known as GABA or glycine, which causes the pain to get suppressed all the time. In fibromyalgia, there is no stimulus like pain or chemical, and still the nerves keep on giving this sensation to the brain that I am in pain. And secondly, something goes wrong in the inhibitory fibers that brain cannot suppress these sensations.
So, right. So the inhibitory fibers are the ones that suppresses
The pain, which are not properly working,
Right.
and then the excitatory fibers are just bombarding the brain all the time with these sensations.
Okay.
And that makes the brain miserable and confused. And it can't sleep because it can't switch off. And that causes fibromyalgia. Now, whether there is some kind of a physical injury or some kind of a neurohormone disturbance or some stress which changed the fibers, we don't know yet. But we know that this is the pathway which gets disturbed in fibromyalgia, and that's why people feel pain all the time.
Right.
And then they get confused that there is no damage going on, then why am I in pain? And that's when they go from doctor to doctor and from test to test, and they can't get the answer. It doesn't mean that they are imagining the pain. The pain is very real.
Yes.
So they are not making it up, they are not thinking it, but they are suffering in pain, which is not mainly in the muscles or joint, but in the pathways. And they are very sensitive to physical pressure. So simple keeping the hand on the table is painless for me. But for fibromyalgia, it can be painful. Just writing can be difficult. Keeping the hand and finding a comfortable position at night with the pillow is difficult. So they are in the pain most of the time. Is there any injury? As I said, I don't know. But sometimes they start after a viral illness, and that's why I think the concept of ME in the past was brought up, whether it's some kind of a viral infection.
Right.
But in modern world, we know that's not true.
So ME is, what is ME? Because
ME, I think, was the word used for this kind of a widespread pain and fatigue syndrome, myalgic encephalitis, when they were thinking it's caused by the virus. But it's not that anymore. The concept has changed. Sleep disturbance contribute to a lot. Because you can't sleep properly, you are tired, and your brain cannot get the rest to think properly and to process the pain. So sleep is also very important. Then there are conditions like dry eyes, depression, anxiety, spasm in the leg. People come with the irritable leg syndromes. Pain in the jaw, they come with the temporomandibular jaw dysfunction. Thyroid disorders, many of the things can coexist and cause the fibromyalgia.
These are related conditions.
Related conditions.
Okay.
Now, what can we do to get better? There is no cure. So if we are thinking one test, one tablet, and we will be fine, it doesn't exist. We have to work together with the patient, with physiotherapist and occupational therapist. The most important thing is to keep active. Keep moving your muscles, keep the blood supply better, keep pumping the heart so that the stamina is better, and then measures to improve the sleep. And generally patients get better.
That's very important.
Drugs, there is no single drug which I can give and it all takes away. The most important part is physiotherapy. Physiotherapy helps to improve posture, physical function, quality of life, and gradually, even if it doesn't take away the whole of the pain, people in few months feel, I'm better than what I was before. Physiotherapy can also advise on the relaxation exercises. There are meditation techniques, mindfulness, reflexology, and all these things put the patient at ease and makes people better. Then there are occupational therapists which can tell you how to perform the day-to-day activity, what can you do with the work, etc. Then there are a specialist pain management program which basically help you to get better in combining the psychological aspect, the pain aspect, and the exercise aspect. There are group sessions led by the psychologist who can help you develop ways of coping with these diseases. Pain is never a purely physical existence. There is something going physically, but then there is a processing in the brain, psychological. Post-traumatic stress disorder, Gulf War syndromes, and other things, phantom limb. These are the conditions in which people can have a pain even when there is no physical insult going on. Especially when it lasts for a long time. The pain affects your mood, makes you feel sad, anxious, frustrated, angry, and afraid. And hence cognitive behavioral therapy has a very important role to play. These therapies can be available through your doctor in the local area, but the emotional response to the pain can get affected, and it affects your behavior. But Exercise, again and again we come to it. Aerobic exercise, swimming, walking, cycling. Sometimes walking causes more pain in the knees and the hip. Okay, don't do that. But then go for cycling and other aerobic exercises which may make it better. So exercise bikes are a good tool. And build up exercise slowly. Pace yourself. And increasing your exercise little by little will help you improve better.
Okay. Right.
Try to sleep better.
Sleep hygiene.
Maintain a sleep hygiene. Don't watch TV too late. Smoke.
Really?
Absolutely. If you are on TV, you can't sleep properly.
Okay.
Especially these handheld devices like the phone, iPads,
Yes.
disturb your sleep.
Right.
Smoking, tea, coffee, all those things. And we have to learn the reflexology techniques, how to block unwanted thoughts from the mind to get better. And sleeping tablets, some people ask for it because they can't sleep and they feel very frustrated with it.
Yeah.
But we don't want people to take sleeping tablets.
Yes.
There are other methods to make sleeping better, and that will improve your stamina and your overall well-being.
And the problem with sleeping tablets are they are addictive.
They are addictive and soon they stop working. You take the sleeping tablet and still you can't sleep. There are other self-help things like simple change in your behavior. Don't worry too much about it. If you worry too much about it, it gets worse.
Right.
Try to learn to ignore it, learn to exercise it, and modify your day-to-day life around it so that you can get better.
Right.
And listen to your body. Your body tells you what to do and what not to do.
Yeah.
And if there are certain activities which is causing more pain, avoid those activities or modify those activities. Unhappiness in the home or work environment may make it worse. So try addressing those reasons. If you need help with your work, take help of the experts like Job Center Plus, Citizen Advice Bureau, who can advise you how to change the work pattern so that you feel better.
These are in the UK, isn't it?
They are in the UK. Of course, there are local help available in wherever you live, and there may be some experts in the occupation who can tell you how we can modify your day-to-day work to help you in getting better.
Right.
Now, lastly, there are just one or two more things. There is a lot of research going on, and we understand that we have not reached the adequate treatment for this condition. We are investigating how people experience pain. We are trying to understand the biologic basis of pain, what goes wrong. People are trying to develop new drugs. There are no fantastic drugs, but we are looking into it. And we are looking at the basic pathways of the pain perception so that we can develop new agents in future to target it. So till that time, believe in your specialist, take in the drugs, whatever available to us, keep active, keep living as healthy and as happily as possible.
Right.
There is a website, if people have got access to computer, which is Arthritis Research UK. I have given the address on this slide, arthritisresearchuk.org. It has got a booklet about the fibromyalgia which they can download on their computer.
Right.
And it's a very good booklet, gives a lot of ideas about what can be done to feel better.
Right.
To conclude, it's a very common disorder.
Yeah.
It's not a rare disorder. It's one of the most annoying and frustrating disorder which I see in rheumatology. And sometimes I feel it's more painful and more difficult than rheumatoid arthritis and other diseases, which it takes over the life of a person.
Really? Yes.
And it makes it very difficult.
Yes.
I fully admit as a specialist that there is no simple cure. But we can work together with the patients, with their families, and try to discuss the ways and the pathways which are the most helpful pathway to make you feel better.
So, it's been a pleasure, Dr. Bharadwaj.
Thank you very
listening
much.
to you. And I'm sure we've learned quite a lot about fibromyalgia. If you have any questions, look at the number on the screen. Contact us, send us a text or email. I will forward to Dr. Bharadwaj because this is a very
My
difficult
pleasure.
condition. And look at our website for more information. We also welcome people who want to partner with Health Corner to continue to bring fantastic consultants like Dr. Bharadwaj to the show. So, this week has been fibromyalgia. Stay tuned next week. We have very interesting topics to discuss.
Fast Tracks Cargo caters for all your door-to-door sea and air cargo services from Nigeria to the UK and UK to Nigeria. With prices from 99p per kilo, you can't go wrong. For prompt, efficient and dependable service, call Fast Tracks Cargo today.